And I want to talk a little bit about management of lentigo maligna. And this is, one of the those difficult cases that always comes up during our, derm path grand round and to about management. Again, lentigo melanoma is melanoma in situ, usually found on the face. It's sometimes difficult. And I want you to maybe talk about the biological potential of this kind of lesion and talk about, different modality. And, of course, surgery is always the go-to option, but sometimes the patient is just not a good candidate. And we sort of push towards using alternative like Aldara cream. But I really enjoy a lot of times you give that kind of a, professorial kind of long explanation to all of us from time to time to remind us. But go ahead.
Well, I'm sure there's going to be a fair breadth of sophistication within the audience for this video. So let me just start out by just going a little more deeply into what is lentigo maligna. So when I explain it to my own patients, I try to help them understand that melanomas come in a couple of different varieties. And I like to think of it as there's the mole kind and there's the freckle kind. And moles tend to be these really discrete spots. They tend to be round or oval, but you can tell exactly where they end and where the surrounding skin begins. And most melanomas that happen on the body look like that. They're the mole kind. But then there's the freckle kind of melanoma. And just like freckles tend not to have discrete edges to them and tend to occur where you get the most sun on the face and on the forearms and the lower legs, that's what lentigo maligna melanoma is. And so those tend to be in more challenging places because they're cosmetically very important. And they're functionally challenging because when they're on the distal arms or on the lower legs, there's not a lot of skin to work with if you're going to cut out skin in terms of closing it. So they could be challenging because they tend to be larger when you first find them, less discrete, so you don't know exactly where they end, and they have significant cosmetic and functional implications. The other thing is, on average, they happen in older individuals. And so it's also important to remember when we're talking about treating melanoma, our goal is ultimately to keep the melanoma from spreading and killing people. And that's something that can happen over decades. And so trying to prevent a death from melanoma in a 30-year-old is very different than trying to prevent a death from melanoma in an octogenarian or a nanogenarian. And so that has to be taken into consideration as well. So those are all elements of what needs to be taken into consideration and how one treats a lentigo maligna. And then getting closer to the question you were really asking, that is, what are the alternatives once you find a lentigo maligna? It turns out that we're pretty good at knowing that the very earliest melanomas that we find, which are called in situ, which means that they're literally in the outermost layer of the skin and haven't made it past what we call the epidermis, a fraction of those left untreated will go on to get smarter, get deeper, spread, and even kill people. But the majority of those probably would never get smart enough to kill us, even if left in place. So there's this general concern that we want to be finding the earliest melanomas and cut them out because then we're done with them. But we also don't want to be over-treating these in situ or very early melanomas, since many of them might not progress, and especially in patients who are older or infirmed or where the treatment can have enormous implications cosmetically or functionally, we need to take that into consideration. And actually a member of our faculty at Memorial Sloan Kettering put together a patient aid around making decisions for treating lentigo maligna melanoma. His name is Anthony Rossi. And what Anthony did was he tried to put this into some perspective that for some patients, it's probably reasonable to just watch these. And only if they look like they're becoming more serious, then treat them. For others, it's a great idea just if they're amenable to cut them out, cut it out, be done with it. But then there's this other third possibility, which is to use a topical treatment called immunotherapy or imiquimod. There's actually a fourth option, which is radiation
Yes.
therapy, which was quite popular back in the 1980s, but frankly is not used very often now for treating lentigo maligna.
No, I think this is a great summary, right? Because you touched upon something very important that one, not all melanoma are the same, right? And especially this kind of variant, this lentigo maligna melanoma. And we sometimes think there's a different kind of biological behavior in this kind of melanoma. Second, you have to take into account of the age of the patient and take into account, specifically, you don't want the treatment to do more harm than the disease itself. And I think sometimes it's always very difficult to have the dialogue with the patient, but I think those kind of dialogue, those kind of discussion is really needed.